He is about to be founding director for the National Center for Disaster Preparedness and senior research scholar at Columbia University's Earth Institute.
Wow.
MSNBC medical analyst Dr. Irwin Redlener joins us now, or as we call him, Dr. Doom. Hello, Doctor. How are you? You know, can we hear you?
Can you hear me?
Yeah,
there you
we go.
Okay.
Okay.
Doc, this time in history seems to have been made for you because every day, as bad as the news is, it just gets worse, doesn't it? I mean, every new thing we're finding out about the virus, every new statistic, whether it's the CDC saying the cases are probably 10 times what they're even estimating. It's hard for a layperson to wrap our minds around. I imagine even as a doctor, it's hard for you to watch this just disaster that keeps unfolding every day, isn't it?
Right. It is totally challenging to get a handle, to get a grip. And like you said, Stephanie, this applies to real experts as well as the lay public and political leaders. And it's a problem. It's a challenge. I wrote an op-ed a week or so ago. It was in the Daily Beast that said that, so we'll probably expect to see at least half of the U.S. population get the infection, although the vast majority will be fine. There will be 15% that need hospital care and some number that will die. But when you're talking about 160 million people getting it, even a tiny percentage, well under 1%, will have a lot more people not surviving this than was previously thought. So, it is confusing. The data keeps changing. One day somebody will say, well, it's not only transmitted by large droplets containing the virus, but it also can be what they call aerosolized, which very, very tiny, almost microscopic droplets that can linger in the air like in an elevator or a small office. So that said, I think one of the things I'm trying to do, Stephanie, is help people get a grip on how not to be intimidated by the constant changing and allow people to function and understand the basics of what's happening. And there's just so much that anybody can absorb about the behind the scenes issues. Like who's collecting the data from the states? For 50 years, it's been the CDC. The White House decided they're moving it out of the CDC to some other agency at the Department of Health and Human Services. It's craziness, and it just makes everything much more complicated. And another example of this sort of even just basic administrative incompetency of this administration. But I'd like to help kind of think through with you and your listeners about what's important, what do you really need to know about, and what are the most vexing problems we're facing right now.
Even when I read this headline, I'm like, oh, that Dr. Doom had to write this. And I was like, yep, Dr. Irwin Redlener. America's on track for 1 million coronavirus cases a day and at least 800,000 deaths by the end of 2020 is what your piece was. And just to give people because I hate to say it, I'm sure you know that your colleague, isn't he at Columbia that Rachel had on last night, Dr. He was at he worked on the AIDS crisis as well. But I mean, just all
David
this.
Ho.
Yes.
Yeah.
But all the stuff he said that they said back in April on Rachel's show, all the stuff you've been saying. Unfortunately, we joke about Dr. Doom, but he said if we all do this together and shut down together, this would have been over a long time ago. If we all do the things you've been talking about. But this is where we are. This is going on forever because of this crazy patchwork quilt. But you write in your piece, Doctor, now it's distinctly possible 5 months from now, half of all Americans could have been infected with COVID. More than 800,000 Americans may die in an extraordinary outbreak. Wrap your head around that number, everybody, if you heard that correctly. That's what most of our prominent health experts now expect. We're still far behind where we should be at this point. And as you've said, testing and tracing, the time it takes to get tests back. If it spreads at its current rate, we could soon see 100,000 new confirmed cases a day. Doctor, okay, so I wanted to ask you, there was another piece just written, it's too late for masks alone to turn the tide on coronavirus, why the U.S. needs to lock down hotspots right away. What do we need to do now? Because this is, we're reading the one study saying everything you've been saying from the beginning, masks, distancing, hand washing, could, be the thing that stops this. But is the virus too out of control now? What in your opinion do we need to do?
Yeah. So and that sort of depends on where we're talking about. For example, if we're talking about what we need to do in the Sun Belt and southern states, that's one thing. What we need to do in New York is another thing at the moment. However, here's one of the problems and why it's so distressing to people. You know, we think we live in a society that has the most up to date, the most modern healthcare system. We got it all here. So the fact that we do not have a medication, we do not have a vaccine to prevent COVID is a very unusual situation. Almost anything that you, let's say you're sick with whatever you're sick with, and you go to the doctor, and the doctor says, okay, well, we can give you this prescription, or maybe you need surgery, or whatever it is that you need. We're used to getting definitive answers about serious health problems. So here we have one of the most serious health problems we've ever faced. And basically, your doctor is saying, sorry, get yourself a mask and stay away from people. And I think that transition from feeling very confident in our medical advice to feeling very not confident is very concerning. And somebody, a public health expert, saying that some saying yes, masks and social separation and contact tracing, that's what we need to do. And somebody else saying it's too late. And it is too late in some places where the community spread has been so wide and so deep that it may be too late, and we're going to need to have another shutdown, or a shutdown if they've never had one. And that's the truth of it. We're operating in a medically primitive reality of not having the medications that we need. So this is where we are, and this is not so much doomsday scenarios. This is trying to manage a complicated problem for which we don't have enough information by doing whatever it's going to take to stop community spread, and especially, Stephanie, protecting people who are highly vulnerable to this from being in contact with somebody who may be a carrier. So that's the agenda, and we're doing the.
Doctor, we kid you, but I mean, it's like Trump saying Dr. Fauci's an alarmist, and Dr. Fauci saying, I'm not an alarmist, I'm a realist. I mean, this is the problem, is I keep saying, I'm optimistic and happy clappy by nature, but there is a reality of this, that we're seeing things that you and Dr. Fauci and others are saying coming true, because, and I think it must be so frustrating to you to go, this is not hard. These are the things that we need to do. I mean, in your piece, you write, experts suggest that wearing appropriate face covering, social distancing are important to controlling outbreaks, but given the explosive new surge of COVID-19 in so many states, it may be too late for such measures. And then you talk about the most terrifying new information to me is the aerosolized, and that it can stay in the air for longer than we thought. You say micro droplets may carry farther than the recommended 6 feet of separation, sneak out around the edges of masks that most members of the public are wearing, and linger in the air. This is a real concern, especially for susceptible individuals in small indoor spaces like elevators or an office. And you say the best shot would be, again, to close bars, indoor restaurants, gyms, beauty salons, barbershops, continue to prohibit sports, entertainment, live political events. What we run into, though, Dr. Wright, because this has been handled so disastrously, is the political will and the psychological will, right? To really shut down again, right?
Yeah. And I think being shut down, let's not kid ourselves. And I'm sure every single one of your listeners who's endured all of this dreads the idea of being in a shutdown situation. It is so counter to everything that we want to do and our normal lives that it's extremely difficult. And by the way, we haven't even gotten to the question, which I'd like to at some point, of the school reopening challenges.
Yes.
But in the meantime, I think there's times in life and in history where the whole population has to be on board. The problem is, just as you're implying, if you don't have federal leadership that is setting the stage, which, by the way, I think Joe Biden would very much be able to do. In fact, it's hard to imagine any president from any party in the last, 60 years being so inept at managing a public health crisis. You can't name a president where we would have seen this, from Nixon, to Ford, or whoever it is. It's just not part of the American expectation for federal leadership and presidential leadership. So yeah, we have a problem, and I think we're going to have to face whatever it is that we have to face, and it's too late to reverse some of the problems that have been we've had. unfortunately, because there was a moment in time where a total national shutdown and the use of masks and social distancing would have been enough to really quell this outbreak. And if you don't believe it, look at what happened in most of Europe. It's just striking
Yeah.
to see incompetent we've been and the consequences of that.
Well, Doctor, this is the thing, and Chris Wallace actually brought this up with the president, which he, of course, doesn't understand, like he doesn't understand most things, but because he keeps saying these things, we're doing more testing than anyone in the world, which, of course, as you know, is far from true, and we're only doing about half the testing we should be doing, and we don't have the tests aren't coming back in the...
Right.
Okay. That FEMA had said we still have a ways to go in having enough PPE. He's done nothing in terms of PPE, reagents, testing, tracing, but it's the positivity rate, right? That's the data that is important. Those European countries, as you know, that's what this piece is. They were down to 1.5% before they reopened. We are, as you know, in Miami, they're at 33%. In all of Florida, 19%. We're at 7% in California.
Yeah.
But, Arizona, Texas, you go on and on. These positivity rates are insane to think about reopening schools, aren't they? 8% of Americans think we should reopen totally at the schools. I mean, that's where that kind of gives you some, that we're not crazy. That only 8% of Americans think it's safe to reopen schools,
Yeah.
Right.
Yeah. So here's the problem, and I obviously totally agree with that. The problem is that keeping schools closed is tolerable for my grandchildren. They have educated parents who are very sophisticated with the use of technology, and the kids are, bright, and they'll do what they have to do. But you take New York City, where there's 1.1 million children in the public school system. 70%, 7 out of 10 children live below or right around the federal poverty guidelines, and many of those children access to the internet, the right equipment to have, and people to help mentor them in the use of this remote technology is just not there. And so it takes children already at risk if you keep them out of school, and puts them even more vulnerable to not getting educated. That is something that we can't ignore. So the answer is, well, what's the best way to open schools safely that will increase the confidence of parents that it's safe to put kids in school? And by the way, it's been already shown that high school age kids, teenagers, already have the same ability to transmit this disease as do adults. But here's the plan I actually submitted to the state health officials and directly to the mayor in New York, which is that why don't we get our philanthropic community? We have the Robin Hood Foundation here, and many multi-billionaires who've gotten actually richer during this COVID variety of reasons. I mean, let's say it costs $1.5 billion to create double the number of classrooms in New York City. So we'd have half the classroom numbers on any given day, but the kids could go back to a school situation on a regular basis. Because if they don't, all of these working parents are in a terrible dilemma.
Yeah.
How do you hold it if your schedule is your child's going to school every other week?
Yeah, no, it's insane. And we didn't even get to this. Now we're way over time. We gotta go. But also the president's saying we have the best mortality rate, which of course is not even vaguely true. But that's the other thing. This one I'm seeing we're like 5th in the world. I guess you're anywhere from, depending on what statistics you're looking at. I mean, that's a lagging indicator, and unfortunately, we're headed up, aren't we, in mortality rate?
So sorry to say.
Yeah.
Headed up.
Yep. Thank you, Dr. Doom. I knew that's the what I wanted to end on. That was so on point, so in character for you. Thank you, Dr. Doom.
My pleasure, as always, Steph.
Dr. Irwin Redlener, thanks so much, Doc. Talk to you again soon. Thank you. All right, 21 minutes after the hour, right? So against character for me. I'm like, I want the guest that's going to make me the most terrified and depressed. That's the guy.
Oh, and then you take it out on us.
Yep.